I would like to welcome you all to this afternoon's proceedings, and I'd like to thank you for coming. I'd like to have a little word of prayer before we begin, and just ask that the Lord will help us to interact. So shall we stand? Our gracious Father in heaven, we thank you for your love and for your protection to each one of us, both in arriving here and every hour of every day. As we discuss families and spiritual healing in the context of families, we pray that you will be with us, inspire and bless us. I pray in Jesus' name. Amen. When they asked me to lead out in a seminar like this, I thought families, I think it would be good if family ministries were here to do this for families. But then I thought, no, the question is healing, not families. And so I came and I approached some very beloved colleagues of mine who I know are really experts and are capable of making very meaningful presentations. I think we're going to start with the ladies first. And Dr. Kitty Fryer Randall, is a psychologist who has done a tremendous amount of work in the area of children and families and the dynamics of families that lead to the successful maturation and growth and the psychological balance of young children in the families. So we're very pleased that Kitty's going to start. I'm then going to have Dr. Mario Ceballos. You notice I say it the correct way. Is that not right?
That is correct.
That's correct. Dr. Ceballos comes from Colombia, and there the double L is a J, so that's what I'm saying, Ceballos. And he brings a wealth of experience because he has a background as a minister and a chaplain. He's worked with the U.S. Navy, so he's worked with young men in the Navy for a long time. He also works in the hospital setting down in Florida Hospital, and he's also worked in the Chicago area with our hospitals there. He is currently the Associate Director for Chaplaincy Ministries at the General Conference, and he brings a depth of understanding that is very refreshing to us in health ministries, as he has interacted with us. Now, we know that behind every successful or every good woman is a good man is a highly successful woman. My wife reminds me of that by having a cushion in our dining room so that even when I sit down to eat, I can see it. And it says, behind every good doctor is a great nurse. And Mario has a great nurse behind him. Gloria, his wife, is the director of nursing at one of the hospitals in the Washington area, and she's also a member of the board, Loma University. And it was a delight for me to see her as she came to the board and began to ask questions on the quality committee. I thought, aha, we'll stir them up here with some of these questions. And so that's why I think that he is additionally equipped to talk about healing. And then I have this good friend who's an associate in the General Conference Health Ministries Department. He actually is our researcher. He works in conjunction with the IPA and the ICPA. IPA is the I was going to say international. It's the Institute for the Prevention of Addictions. And the director is with us here, Dr. Duane McBride from Andrews University. But Gary is charged with the responsibility of doing research. And he has had an influence on Health Ministries Department that is probably far beyond his own comprehension of just what an influence he's had. He challenged us, and he challenged me when I first came, that every program that we had was perhaps not hitting the mark. And so just last week, I found I was writing a letter that you would have been proud of, Gary. It said, lectures and didactic talks probably don't achieve the intended objective because you can't just tell somebody something and wave them goodbye and think that you've wrought any change. Change is mediated through relationships. And if we don't have relationships with the people that we're trying to do things with, really we will achieve very little. It's Gary who has brought that very strongly to our attention, but then has supported it with an evidence base. Because, as you know, an evidence base is very important for many of the things that we would talk about. Gary not only has searched the literature and provided an evidence base, he himself has independently done research on Adventist communities, non-Adventist communities, and has provided benefit. Gary is coughing here, and I'm looking at him, and I'm thinking, I don't know if he's as fit as he needs to be. Gary has lost a lot of weight and is looking to me younger than I used to think he looked. But of course, I don't know whether his wife's happy about that, because now all the ladies will be looking at him and thinking, what a handsome chap he is. Yeah. So before we do anything else, I'm going to welcome Kitty, and I think you will enjoy her. I would like you to see this as a workshop. I know the cameras are on us, and they're expecting to tape all of this, and that's all very fine, but a workshop works when you interact. And we want you to ask questions. We don't want you to feel that we can't be stopped. If you stop us, we will take your questions, interact with you. We might even ask you some questions. And so then we can know that we can be free to make it. You know, when we sit all morning as we have, our mind can only comprehend as much as our derriere can endure. And so I want you to feel free to interact and be free with us. Kitty, so nice to have you.
Thank you. It's a pleasure to be here with all of you today. And I'm a pediatric neurodevelopmental psychologist, and I would say my passion is to work on behalf and advocate for children, but my work has really been around children who come from dysfunctional homes, particularly those who then have suffered trauma, abuse and neglect, or live in drug-endangered environments. So I'm going to try to weave all of that in through to what we're talking about today, but to really also address it in the terms of that it's amongst all of us. This issue, this concern of needing healthy atmospheres in family and the need for healing in families is a part of, I think, most homes and certainly every congregation. And so I think it's very, very important to all of us. First of all, we think, what is a family? The dictionary describes it as a group of people who are affiliated by, I'm going to say blood because I don't know all the medical terms, but affinity and co-residence, meaning they're typically related and they live together. And in most societies, this is key because it's very important to think about it this way. In most societies, the family is considered the principal institution for the socialization of children. Okay, and so it holds a very, very significant role in terms of our future. And we know, as Margaret Mead said, the problems of tomorrow are dealt with how our children are raised today. And so the family is a very important part of what's going to happen for our children in the future. Traditionally, we viewed family from what we call a nuclear family. Father, mother, children, first marriage, and often think of it, the father is the breadwinner and the wife is a homemaker. That thought or imagery of what we have traditionally thought of as family in the United States represents only 6% of children growing up in homes. More and more, we find more single-parent homes, predominantly single-parent mothers in many, many situations. And I have had the privilege and the honor of working with Dr. Hopkins and Dr. McBride and others in many countries and many regions, and have found this number growing also in other countries in Europe and Eastern Europe and in the Caribbean, etc. The other thing, though, is that the issue of shared home, that family is a variety of people who might be sharing this home, whether it's culturally based. In some cultures, more members of extended family are part of that home. In situations of economics, and I can see that in the United States, in my neighborhood, where more people are starting to live together, and so some of them are related and some not. In those children I work with who come from homes that have suffered maltreatment or live in drug-endangered environments, family is a very nebulous term, and it changes all the time. Who's in the home, who's not in the home changes, whether they're with a primary caregiver, and if that caregiver changes, often happens for them. So for many of the young children I work with, family is a very, very difficult and ambiguous construct because it changes all the time. If we now think of dysfunctional family, if you look at the research, or if you work in the field, the idea of dysfunction means that there's some kind of conflict or tension. Something is not in synchronicity. Something's not working together. So it also results in thinking, well, if there's dysfunction, it means something is misbehaved. Something is wrong. Something's right, something is wrong. Something's not working. It is also there's a high likelihood that in these families there's situations of neglect of some, whether it's the children, the spouse, some member of the family is being neglected and potentially also abused. These kind of dysfunctional behaviors occur continually and regularly in a dysfunctional home, and it leaves vacancy for traditional family roles. Because of the need to continue to focus on these dysfunctions, you can't have a smooth flowing role in the family. It often occurs primarily as a result of codependent adults. I need somebody to behave a certain way, or I need you to be dependent on me, okay? So there's this kind of, I recently heard, he's a comedian, but he has a lifelong history of addiction, and he really testifies to God in his life and having turned that around, but he uses what he calls the humor muscle in order to try to reach the audiences about the issues of addiction, etc. And when he was defining in his kind of comedy show, he was defining what is a codependent. He said the codependent are those who go, ah. So if I told you a story about my bad childhood, those of you out there who would go, ah, then you'd be the one that I'd want to connect to if I was needing a codependent, because I'd be like, wow, a magnet force to say somebody who's going to be able then to be there and connect with me on that level. So, but there's often codependency in the dysfunctional family. It is often affected by substance abuse, by the nature of the tension and the adult roles that are happening in those environments. Not always, but often. Sometimes it's related to untreated mental illness. Other times it's related to extreme need for control or rigidity in thought, okay? And sometimes it's related to unreasonable expectations. This is very key for homes where there's young children. The number one reason for physical abuse happening in a home is a parent having an unreasonable expectation of the child, particularly the younger child. In the first year of life, outside of the medical reasons you might die, the number one reason you will die in your first year of life is because your parents will kill you. So it's very significant to understand that much of what happens in dysfunction is unreasonable expectation of spouse or children or other family member. It's a very significant issue. The other things that happen in this is there's a real lack of empathy. It's amazing to me when I work with the families I work with that the absence of being able to be, never mind sympathetic, empathetic, even though you've had similar experiences. Empathy is a construct as a developmental psychologist that I can start evaluating at about 18 months of age. But unfortunately, it doesn't really develop much beyond that for many who have been in situations of trauma or stress. It's also related to a lack of understanding towards certain family members. It might mean that you have extreme sympathy. You know how dysfunction can be? I might have extreme sympathy for you, but put all the dysfunction here in terms of the tension here. So it could be that somebody in the family home is given all the attention and somebody else neglected or abused. That's also a part of dysfunction. Some of the other universal common features are those of denial or avoidance. The refusal to see that what you're doing is harmful or abnormal or could be hurtful to another member in the household. In fact, in dysfunction, it's not just that I can't see that this is harmful, that I don't buy into you saying this could be harmful to my child. You're also saying, I think it's beneficial. How many times have I heard, no, I must beat my child because it says if you spare the rod, you spoil the child. I don't have time to get into the whole biblical part of that, but the rod in the Bible is that of guidance and nurturance. It's not for beating. And yet, those who believe the rod means you have the parental right and duty to beat your child, not only do you not believe me when I say that's not good, but also then you believe it's beneficial because you are validating your own belief system. In these homes, we talk about it as if there's an elephant in the room. And I don't know if that is a more English saying or not, but let me describe that a little. The elephant in the room means, let's say that you and I have a problem, but we don't want to discuss the problem because neither of us want to go through the tension and we both feel we're right? Or for whatever reason, we don't want to talk about it. So there's a big elephant right here. And every time we converse, we walk around the elephant or we talk over the elephant, but we never deal with the problem. In homes where there's dysfunction, there is an elephant in the room almost constantly. You work around the issue or over the issue or you avoid the issue, but you never, ever actually deal with what's really happening in that environment, okay? There's also a disrespect for boundaries. A disrespect for boundaries could mean that I don't let you have your own thought. I don't let you have your own way of behaving in the world. But a disrespect for boundaries with children means abuse and neglect, okay? It could be the need for control or domination, that only my view and the way I have things and want things done is possible. Also, another thing can be manipulation, to manipulate others to get your needs met. The other one, and I think this is one that we have very frequently in our environments, is what we call the public image manager. There are things happening in this home that you are not allowed to talk about outside of this home, right? And so you will be in trouble, in whatever that means in your home, if you ever reveal any of the secrets of this home, okay? Dysfunctional families have a lot of public image issues because there's always secrets that you have to keep. It is a huge concern when you're in an environment where there's more and more roles required of what that image should look like. When we're in a religious group that has a lot of norms, there's a lot of public image that's necessary. As that person told me, what was quite interesting, that person that I mentioned to you who is an addict who also really talks about his journey through it, he gave us some shortcuts of what are some ways that if somebody who has an addiction of any kind who says, well, I can't do this or this comes in the way or da. One of the biggest shortcuts, he said, is to go directly. A shortcut doesn't mean getting away with it. A shortcut means directly to the truth as quick as you can. He said one of the first shortcuts you always have is, if you have to keep it a secret, don't do it. And yet in homes of dysfunction, this is the way that those families often thrive. What we see on the family level is that there is a decrease in normal and healthy family functioning. The environment is often chaotic, not knowing expectation changing with the whim of those who are enforcing it. There's no role stability, or there's very rigid roles not allowing for any growth or change. And there's very poor communication. The other thing that happens is the more the family becomes dysfunctional, the less outside support they attain. And what we know is when we're under stress, we need more social support. And Gary's going to talk more about that. And then what happens here is you get less of it. When you ask someone, and this happens very often when I work with women who live in shelters, we're asking them to leave a dysfunctional environment when they have no support. And unless we're willing, as an individual, as an agency, as a church, to become part of that social system, you're asking something that is almost too hard to do. We have to know that that's a very significant factor. The other thing is that of neglect or abuse, and I'm going to talk some more about that. But in dysfunctional families, on the family level, there is often either partner or child abuse and or neglect. Substance abuse is also a very, very significant issue for the dysfunctional family. And these things often co-occur. Okay, so I want to talk to you a little bit about that. We know that how you experience your environment will impact how you develop. Okay? So when we say, does the environment impact you? Yes. But it is more the relationship to your environment that impacts how you will then go on in life. So I don't know, some of you may have siblings, you came from the same home, and I don't know if you've ever been like me and you have a sibling say something about your home and you're like, where did they grow up? You know, that's not how I experienced it. It could be a similar environment, but a different relationship to that environment. And what's key to how you will grow up from a dysfunctional home is your relationship to that environment. What it meant to you and what values or what kind of characteristics you took from it. So ecology is is really how I look at the work I do. When I'm working with children or families, I'm looking at always from an ecological perspective, not just what is their environment, what is their relationship to that environment from their developmental view and developmental point. As such, children in that relationship to the environment will take on different roles in the dysfunctional family. Some of these roles we've heard of or are common to us. The first one is one we call the good child. The good child is the one who becomes the parent in the home because the parents aren't, remember there's no good role stability. The parents aren't filling the role of parenting the younger children, and so one of the children take it over. I remember Sarah, who was 5, and she was the caregiver to her 3-year-old and 10-month-old siblings. When they were removed because their home environment was very dysfunctional and unsafe, she was put with her siblings in a foster care home. Who do you think was the biggest problem in the foster care home? Sarah. Why? The big complaint was, she won't play like a 5-year-old, she doesn't act like a 5-year-old, and she's not complying with this, because now there is a parent. And Sarah doesn't need to, but does Sarah know how to be a 5-year-old? No, she's never been 5. She's always been the parent in that home. And so the thought was, as our systems would have it, is to remove Sarah and put her somewhere else. That would completely fragment her because now she has no role at all. Instead, what we have to do is help her to be an assistant and then learn what it is to be a 5-year-old. But we have to meet children, people, where they are, understand their ecology, and help them to move through that in a healthy way so that we can assist them. So the good child. You have the problem child or the rebel. This is what we often call the scapegoat, right? Any problem occurs in the home at all, it goes to the scapegoat. Anything happens, and they're the ones who usually get the brunt of abuse, okay? They're usually the ones who get the brunt, at least of physical abuse, not of some of the other. The caretaker is the one who's sort of the peacemaker, wants everybody to be emotionally okay. Sometimes that's the parent role, but not always. In fact, not typically. The one who, because they want to negotiate between the parents and the children, make sure they're kind of the ambassador, and they want to make sure everybody's okay, and they're always anxious if there's tension. They're always trying to make it better. And then there's the lost child. This is the child who withdraws from the situation because they fear, they're anxious, and so they withdraw from those things. So there's different roles that children will take on. While we're talking about families, as a pediatric psychologist, this is the platform I always have to take. I care so much about the family, but my voice is for the child. And it may be surprising to you that when I work, even with judges or others, when there's a family situation that's very dysfunctional and hard for the child, most of the time people will think to give services to the parent. They don't think to give services to the child. And so I have to advocate that, yes, the child is a member of the family. And if you give the parent services, I'm hoping it affects that dysfunction. But the child themselves is also significantly impacted and should not be forgotten. They should not be the lost child. They are not a misunderstood victim. They are a part of the situation that have their own needs. So while we need to get service for the parent who's having the dysfunction, while we need services for the family, the child may have needs above and beyond that for them, okay? Often children who grow up in drug-endangered homes where substances is a problem. And when I say substances, I'm not just talking illegal drugs or alcohol. I'm talking those who also misuse prescription drugs, okay? Which is more of an issue in our circle than some of the other illegal things by the way we were raised, right? But also children with trauma, children who've experienced significant trauma. They have needs that are often not met. If you look in the United States, 85% of the states in the United States, and the other 15% were probably sleeping or didn't participate, they report substance abuse as the major problem in homes where children are maltreated. It is very significant, and I'll tell you, of the research that I've done internationally, it also bears out the same way. If you think of a child who's removed from the home, you have to be thinking, in many cases, about 75% of the time, that substances were involved. And so I know sometimes we like to think that we live in a world where there are no substances because it's something that we hold so strongly in our message and in our health message. But I'm here to tell you, if you're not aware of it, it is in your congregations, it is in your churches, it is in your homes. When I have the honor and the privilege to do travel like this and to present internationally and also within the United States, I'm often stopped by many of you who come to me and say, thank you for saying that, because so many won't let us have the open voice to say it. And so the place where we should be getting the support for our dysfunctional family, we cannot. Remember the public image manager? Well, we manage ourselves not to get help because it's not permitted. But I know that within this conference, there are many of us who may have experienced these situations or have it ongoing in our homes. And so we have to find ways to help those persons in our church and in our groups as well. So I want to share with you just a little story about Rachel, because I want you to know that children are trying in some way, maybe not like Rachel, but in some way, if there's something going on in their home, they're often letting you know, whether it's at Sabbath school, through their themes of drawing, through their themes of play. Children are asking for help, and we don't see it. Rachel is 7 years old, and she's in the first grade. And her teacher asked the class to write down or draw what they would do if they were president of the United States, okay? So Rachel did this. She said, if I were president, I would get a limousine. Do you see her limousine she drew down there? Okay. She would get a limousine and help children that have parents that do drugs and put them in jail and find them some new parents. Do you think Rachel's asking for help? Did she get any? No. Did her teacher ever even bother asking her about this? No. No one did. It was only when she was about 14 years old, her parents went through their drug treatment program. And when she was 14, her mom was cleaning her closet and found this crumpled in her closet. And she looked at it. And even though she knew that the household dysfunction might have affected their child, they never got her treatment. It wasn't until she saw this that she realized that what they had done in their home had impacted their child, and they got her help. How many times in different ways have children let you know that they might need your help, and we ignore them, and we don't help them? And what do we know happens if we don't? We know that children who have negative experiences in homes of dysfunction as a young child, it can disrupt all areas of development. Now, I'm not just talking about substance using homes, although they're the ones who have a lot of chaos in them, but any home that has a significant amount of dysfunction in it can affect all areas of neurodevelopment. Do you know why? Because God designed us, and Dr. Handysides kind of mentioned that with the work that Gary's done in the past. God designed us that all areas of the brain develop in context of relationship. And so that's why you have the primary caregiver, right? You have a primary caregiver giving you all of this attention. And that is supposed to help you lead a healthy, regulated life. If your primary caregiver is dysfunctional, and actually all your caregivers are dysfunctional, which happens often in this kind of home, it more likely affects any area of development. Let me just give you, because it's a little bit of a side, but it's so powerful, I think, when you think about how we were created, you know? And I love to share, no matter my audience, I always share about the beauty of how we were created in terms of development and in terms of how that really relates to health and well-being. Think about vision development. Those of you who work with infants, you know, for the first few weeks of life, what's the best vision? The distance of breastfeeding, right? Right here. If you go any farther, blurry vision. Any closer, blurry vision. This is where all the focus of the baby needs to be. The vision is not more developed than that, because all learning needs, the rest should not be even seen. I think sometimes I pray, God, you know what? I need to be that young and just see you right now, because I am so distracted in my world. But when we're born, this is it, right here. Now, for me, that's related to attachment. So I get very worried when mothers prop their babies to feed them. Because right now I am taking the number one attachment, all area of the brain development, and I'm not allowing it to occur. Now think, because all areas, remember I'm telling you, this is not just attachment development, it's all area of the brain happens in relationship. Vision. I was working with some developmental ophthalmologists, and they listened to what I said, but they said, hey, there's more to the story. This is how eye muscle development occurs. When the baby's propped over there, they're not getting the right eye. And you know what else? Why you have two breasts to feed? Is because you have to develop the vision on both sides. So if you only hold a baby ever on one side, the other eye muscles don't get developed correctly. Do you know what they said? Their biggest fear right now on vision development is texting, because the mothers can only text with one hand, and they're always holding the baby in the other arm, and she's not getting the vision down. So the mom's feeding like this. So not only is attachment not occurring, but the baby doesn't get both sides of the vision as well. But do you see how wonderfully we are made, that everything is designed in a way that with relationship, everything will grow? If you don't have these experiences, it can impact you. I'm going to show you a home of 2 young children growing up in this environment. Now, the shovel is there because they've already removed the feces and other things out of this house. So for those of you from a health perspective, you would be worried about the actual sanitary hygiene health in this home. As a psychologist, yes, I'm still worried about that, but what I see also is, what kind of language development do you think is occurring in this environment? What about behavior or the social emotional? Cognition, thinking, attention. Attention, which requires you to focus. How are you developing it in chaos? And memory, which requires you to be able to file things, right? What about meaning making? A value system. There's one developing, but it might be not the one we want as a society. I had a family, not this home, but it was like this home, where they came to me and said, this 4-year-old, because I do consulting on these families, and they said, the 4-year-old's having trouble in school, we're sending him to the psychiatrist for medication for ADHD. And I said, well, you know what? That might be a pathway we have to go, but it is never your first line of defense. Remember, ecology. You want to know who's the child in that environment. So I said, what is their home like? Well, we don't really like to go there. Well, if you don't like to go there, that's a red flag that something else is going on, right? And so I said, why don't you like to go there? Well, within a few minutes at the house, there's cockroaches on us. Well, you think maybe the child's not getting enough sleep if he's getting bitten by bugs at night, right? So the first line of defense isn't sending the child to a psychiatrist to get medication. It's going over to the church, and fortunately we have one around Loma Linda, that the first Sabbath of every month they do a mission service. And we, as a mission service, we cleaned this woman's home. That's what helped change the dysfunction for that child. It also changes your emotional landscape. We are beings of our experience. If it's all you knew, then that's what you're going to seek out, right? So I want to show you just a little short video in terms of, because people, I can't imagine, how many times, and you have to not smile and you have to not go shake your head and you can't get discouraged, but how many times parents come in and they say, I don't know why my child's behaving this way. And they're behaving just like that parent did with you or with the secretary in the waiting room or wherever. So I want to show you this little video. Hopefully I have it so it's working. Can they see the video? Oh, yeah.
Looks like rain again today. Dark clouds gather and fill the sky. Don't know how to talk to you, just know how to say goodbye.
What children see, they do. And we are the role models of what children will do. just to bring it a little closer to home, I'm using some data that Dr. McBride and I think Dr. Hopkins, you were a part of this at Andrews University, where they asked students about substance abuse. So it might surprise you that there are actually percentages of students at Andrews who are using all of these substances. But then, look at the top. It says whether parents used or whether or not they didn't use. And you can see every time it says, yes, a parent used, what do you see about the percentage rates? They at least triple. We're not any different in terms of what our children see. It's not what you say, it's what you do. And as a church, we can't just be preaching, we have to be living. And we have to model functional families because many families have never experienced what it is to be functional. We are on second and third. You know, I work with cops who they're arresting the grandchildren of the person they arrested a while ago. I mean, we have generations of time where these things haven't been happening. I want to talk to you about why that occurs. Why is it? How are we connected in the brain? Why is it we model things even if we know it's not the right thing maybe to do? Why do we become that way? We know that children who grow up in dysfunctional families are at very high risk for themselves to marry or to become dysfunctional themselves, to marry into it or be dysfunctional themselves. Children who are abused are at significantly high risk to choose a partner who's abusive or for them themselves to be abusive. Children in homes where substances has been the way to handle life also do that. So we're going to go into another part here of talking about what happens. How do we then go into this? I wanted to take you biblically, okay? Into the Bible to understand what's happening. Because when I first read this as a young person, I thought, this is not really how I thought God was, and so it seems just a little, I don't know, punitive, but it says in Exodus 20, verse 5, I'll start in the second part there, "For I, the Lord your God, am a jealous God, visiting the iniquity of the fathers upon the children to the third and fourth generation of those who hate me." I see generational diseases passed on, generational issues of maltreatment passed on over and over again. And then I read in the Bible that this is something that we've been told will happen, that unto the third and fourth generation will be the sins of the father. Why is that? From a neurodevelopmental perspective, I want to understand this. Look at this picture that shows, it's from a public service announcement in Mexico, that shows the generational circle, that cycle of being abused to then becoming the perpetrator of abuse. We see it in every culture, every community, every subculture. And how and why is this happening? I want to talk to you about it in terms of templates or patterns. Our brain develops in terms of patterns of behavior. If you do something over and over and over again, it becomes a pattern. It becomes a way you do things. It's a way you're comfortable. It's as much as we like somebody visiting church, we don't want them in our pew where we usually sit because that's our seat. We are that habitual, is that we want to sit where we usually sit. The more a connection in the brain is active, the more you will have a synaptic. Do you know when we're born, we have so many more synapses than you need, okay? Patterns occur that make what happens, those connections that make. And if they are dysfunctional patterns, those are the ones that get laid down. Now, I'm going to do a couple of minutes of hope at the end, so don't get worried with me on this. But it is how we behave the way that we do. A repetitive activity gets ingrained in your brain, and even without your awareness, you continue to do that. I want to tell you how that happens from a neurodevelopmental perspective. We're going to talk about tolving. Tolving was one of the primary memory theorists that we use in psychology. Okay, he's Russian. And he talks about 3 types of memory. Episodic, an episode. It's in your awareness. Have you ever been to Prague? It's in your awareness. You can say, yes, I have. It's ready for recognition and recall. Then there's semantic memory, also in your awareness, but it's a feeling memory. You can say, have you been there? Yes, I have. And when I was there, I met neat people, so I have a good feeling with it. It's sort of sometimes when I eat more Russian food, it reminds me, my mother was Latvian. And so it reminds me of that. It gives me a feeling. I feel at home. You smell something and it reminds you of your childhood, hopefully a positive one. But those are feeling memories right in your awareness, ready for recognition and recall. The memory that we deal with, that we struggle with, and yet is a gift of God, is our procedural memory, outside of your awareness. Habitual reflexive response to yourself, other, and the world. Procedural memory would be, for example, well, the brain has to be efficient. Every day you shouldn't be learning everything new all over again. I don't know if some of you are like me and you start getting older and you're like, I feel like I'm learning everything new all over again. But it's not. Your brain becomes very efficient and it says, you know that, forget about it. So I could have you turn to the person beside you and I want you to tell them, how do you tie a shoe? Yeah, now there's Velcro, right? Okay, so it's a little hard to do, but you know how to do it. You know how to do it, but you don't think about it anymore. In fact, now you could tie a shoe and tell a story at the same time. What about walking? Do you know when you get up where you put your weight first and which one? A baby who's learning to walk is thinking about all of those things. But okay, so here's the key, because remember, as Christians, we're often asking people to change behavior. It's not just say no. It's not just, you're changing brain pattern, okay? It's very hard. So here's the thing. What you're asking is, if you start thinking about something like walking that's in your procedural memory, what happens? It becomes awkward and you could fall. So I don't want any of you to get up and think about your walking. You already have it in procedural memory. But what you're asking is for things that have been laid down in your habitual response. You're asking for people to take into awareness, do something different with it, and then lay down another one. That takes some time, and that takes commitment. Okay? And as I bring it into awareness, I'm going to be more clumsy about it, awkward, self-conscious. I'm going to need more support during that time. Sometimes we say, but I only run into people maybe once or twice when I'm doing a talk or something like that. It doesn't matter. When you meet people, your interaction with them can validate a negative procedural memory or instigate a new positive one that they might be working on. Let me give you an example about how these things how early on this develops. It's related to how you think about yourself. There's a French researcher named Philippe Rochat. He's one of the most profound researchers in the development of understanding yourself, okay? The development of that self-cognition, that I exist. And we used to think that happens when you're 5 or 6 or 7 years of age, but it happens at birth. Let me tell you what his study did. He took the time to just observe babies. I wish sometimes we just had time to just be and observe. But he took the time to observe babies, and what he noticed, you know the rooting reflex? You touch the corner of the mouth, the baby goes in that direction, right? For food, right? It's for survival. It's part of how we're created, to go in that direction. What he noticed is within the first couple hours of life, the baby does not move to their own touch, only to other touch. The baby already knows the difference between me and other. I know how other treats me. I know if other meets my needs. I know if other is there for me from birth. Those habitual responses to life, which are the records that play in outside of your awareness of whether you have self-worth, Whether you're going to grow up to be a so-and-so, like your daddy, who your mom didn't like, or whatever those records were, those templates and patterns are happening in your brain. And most of your procedural memory is laid down in the first 18 months to 3 years of life. How you feel about yourself, other, and the world is laid down very, very early on. This is how Paul talks about it in Romans 7, verse 15. For I do not understand my own actions. I do not practice or accomplish what I wish, but I do the very thing I loathe. It is procedural memory that even though you want a different way of behaving, you end up doing that. This is why children who grow up in dysfunctional homes, as much as they did not appreciate that environment, perpetuate that environment in the next generation. And this is how we see onto the second, third, and fourth generation of similar patterns and behaviors. So, in order to really understand the impact of the family on the child, we must know their history, that ecology we were talking about, but we must also be able to say, I believe in understanding and changing future. Now, it seems, the way I've presented it, it's in your brain, it's part of your neurodevelopment, it's how you are already acting with the world. So it seems like, what are we going to do now? Because it is outside of your awareness. How do we change the generational pathway? Well, let me give you first a study that talks about if you don't change the pathway, what happens. There's a study that talks about that the events that happen to you in your life leave a record in your brain. The nature of the record in your brain, just like we were talking about, is related to the nature of the event. This study looked at adverse childhood experiences and said that adverse childhood experiences can alter your development and lead to a life of vulnerability. And I want to tell you about this study because it's very impactful. These are the 10 questions that they asked adults. So I could ask it of you. I just ask that if you come up with your score and you're worried about it, that you wait till the end of this whole thing, because there is healing. But I'm going to tell you some significant information here. They asked 3 questions of abuse. If it happened to you, your score is 1. If it didn't happen to you, you say 0. So don't tell me, you can figure it out for yourself. But if as a child you ever felt emotionally or psychologically abused, you would have a 0 or 1. Not that anybody validated, just how you felt. Physical abuse, 0 or 1. Sexual abuse. Neglect had 2 categories, emotional abuse or physical abuse. So now you could have a score of 0, or the highest score would be 5. On the other side of the scale, it was looking at household dysfunction, what we're talking about today, family dysfunction. Was there substance abuse in the home? 1 or 0. Did a parent separate or divorce in the home? Was there depression or mental illness in the home? Was there domestic violence in the home? Or was a family member ever put in jail or imprisoned? Your score is 0 to 10, okay? Somewhere in that. They asked 17,000 adults this question. It's the largest epidemiological health study done to look at how childhood events impact health. And like I said, it was just categories, not a number of events. And here's what they found. As the number of scores increased, so did high-risk things such as alcoholism, depression, family violence, but not only that, these were physicians doing the study. They were looking for medical indicators. They saw an increase in heart disease, chronic lung disease, liver disease, obesity, sexually transmitted infections. And they found that it was in a gradient fashion. And in statistics, that means 2 is higher than 1, 3 is higher than 2, 4 is higher. So this is what they found. But this is the results of the study. The greater the number of these experiences, the greater the risk of disease, early adult disease and death from any cause. And get this, talking about health. Many chronic diseases of adults are determined in your childhood, not by disease, but by the nature of the things that have happened to you. It's very significant in understanding if we are going to do things to help people be healthy, we must address these traumatic situations in the dysfunctional family. Look at these percentages. These are not small percentages. These are findings of the decade, they say. With a score of 4 or more, you have a 460% increased risk of depression, or 1,220% increase in attempted suicide. I mean, this is so impactful. If you have a score of 0, but somebody else had a 4, these are the percentage differences that they found in the study in terms of impact. Here's one example. A male child who had a score of 6 has a 4,600% increased likelihood of becoming an IV drug user compared to a male with a score of 0. The children in our environment that are in dysfunctional homes are our highest risk group that we have to be aware of to, as a community, provide preventative work. The Center for Disease Control in the United States was so impacted by the results of this study that they wanted to look at it further. So they went back and they funded the study to now look at the elderly population of those who had significant events. Do you know what? They could not do the study because they had died. If your score is 6 or higher, on average, you will die 20 years younger. They said it was like trying to do a study of long-term survivors who have worked in coal mines. You can't do it. But this is what we have found, and this is the trajectory they say. You have adverse things happen to you. Remember I talked about neurodevelopment. It disrupts that. Then it affects your social, emotional, and cognitive world. You adopt high-risk behaviors or health risk behaviors, and then you have disease, disability, social problems, and early death. Our job as health community is to get people off the pyramid. That's what we're doing, right? As health ministries, our role is to get them off of this pyramid to a healthy trajectory, because this is a -1. We must understand that many are at risk, but they are not doomed, right? That's the whole message we have, that we're not doomed. We must believe in resiliency, which Dr. Hopkins is going to do more of, but we have to intervene by design, which means you have to actually be thinking about it and thinking about how we do it. So I want you to start thinking about a culture change that we need to do, a health cultural change in our community from a psychological perspective. I grew up in a church that if there was a child who was bad, we were not allowed to play with them. They were not, oh, we don't want that child at school. In our culture, we called it a bad apple. Do you know what I mean by a bad apple? It means in this bushel, there's an apple in there that's bad. What will it do to the other apples? It will spoil the other apples. So you don't want it in there. But you know what? So many of the children that have these high-risk behaviors, they are not bad apples. They have been in a bad barrel. And if we're going to help them, we have to help them by being a healthy barrel. There was a study that was done by Zimbardo. This was done in the 1960s, 70s, I think. He was a big researcher, and he wanted to look at the psychological or sociological components of the prison environment. So he took male college students, just volunteers from the college, and he made half of them prisoners and half of them guards. Okay? He had to stop his study within 2 weeks. Why? Because of the horrible behaviors that both the prisoners and the guards took on. Now, unless we inherently think college male students are a problem, we won't go there. It's not because they were bad apples. They were in a bad situation, in a bad experiment. If we are going to help dysfunctional families, the environment must change. If we continue to tell people that they have a problem or they are a problem, what will happen? Do you know the story about social labeling? Do you know the self-fulfilling prophecy? So we'll cut the room in half. on this half of the room, you're in grade 7, okay? Think about being in grade 7. And I'm going to give you a little mouse, and you have to teach your mouse to run the maze to get the cheese, okay? But you guys have a genetically engineered mouse to be very smart. Over here, you're also in grade 7. I'm giving you a mouse. You need to teach your mouse to run the maze. But you have plain, not very good breeding mouse, just a regular lab mouse, okay? Over here, you're so excited because, you got the smart mouse, right? And so you get the Excel spreadsheet out, and you got, who's feeding when, temperature, water, running the maze, etc. You have all that going. Over here, you're disappointed because you have regular mouse, not very bright. So after a day, one of you says to the other, well, did anyone feed our mouse? But if they're not so smart, do you think it really matters, or they will remember? So then one of you actually decides to put the mouse in the maze, but you're not very careful. We're not very careful when they're not so special, right? And you accidentally drop the mouse on the head, and you're like, well, I wonder if a little head injury matters when you're not very bright anyway, which 2 moms were saying in my waiting room once, so I was a little worried about that. But anyway, we're back to the mouse. So over here, your mouse is ready for Mouse Olympics. I mean, you were so proud of your mouse. You got him going. You have him all trained. He's so fast. Over here, this mouse hasn't really even learned what cheese is yet. Do you know that experiment was done with 7th graders? And here's the point. There was nothing different about those mice. They came from the same litter. The only difference about why good outcome and poor outcome was the label that the experimenter put on the mouse and how the children treated the mouse. What are the labels we use in our church to discuss about others and children and families? And then how do others treat them because of the labels we've given? This is an important part of what we're talking about. Whenever I'm working with a child, somebody shared this with me a while ago, and I try to remember that because I work with some very difficult cases. And I try to think about this because it's so much a part of what we see neurodevelopmentally, is what you think of me, I will think of me. And what I think of me, I will become. How we relate to each other is impactful for how we predict the trajectory and the outcome. What we know, though, is that if we do provide other opportunities, if we change the barrel, if we do something to provide healthy experiences so that whenever you're with me, your brain learns a healthier way to think and respond, we can help change that. There is scientific evidence that shows that neuronal regeneration is possible given the right environment. This was from the Hardwired to Connect report. If some of you are interested in it, it's a fabulous report that talked about why are so many children on mental health waiting lists and what should we do about it, and it provides the research there. It shows that if we have, and this is where that nurture nature, and we get all caught up, oh, well, their genes have, so we can't, and we get all caught up in that. But what it shows in the research really is that even a heritable vulnerability can become a positive behavioral asset if you give them the right improved social environment. This is our reason for optimism. This is what we, in a different way, from a scientific way, what we preach in our church is that we can provide ways to do that. What children, what people need from dysfunction, from anywhere, what the research shows is what you need for a positive trajectory is connectedness, relationship, and spirituality. A meaning making. In French, we say a raison d'être. You have to have a reason to be. And I do not know anywhere else better than for us as a church to give that to people. How many places can you find both healthy adult connection and a reason to be? This is what we can offer. If you look, there was a book done, From Neurons to Neighborhoods, of why people act and react the way they do. It's because the single most important component of a child's healthy development is the presence of an enduring, healthy adult caregiving relationship. I'm not going to go into the hows and whys of that because Dr. Hopkins will. But I want you to go back to that Bible text I started with, that I was concerned where God said, unto the third and fourth generation will be the sins of the father. The very next verse, and I hate that when we stop too soon, because then we get stuck, right? But the very next verse, he shows us what it means to change trajectory. He says, but showing mercy and steadfast love to 1,000, not second and third generation, 1,000 generations of those who love me and keep my commandments. Love and a relationship to God our Father changes the trajectory of the third and fourth generation. So relationships laid down that negative trajectory. It is relationships that can change it. Only in that. We are created that way, only in that way. We have to help our young people and families get off of that triangle. And it is only possible via a relationship to God and our relationships to each other. There be many children who look like they're in a flowering garden when what they're really asking for is help. And I ask you to be aware, alert, and don't just let the elephant be in the room. But if a child is, and you know there's a family that's having significant stress and dysfunction, that you be there for them. We used to do conferences for the clergy in Southern California on issues of trauma or these kinds of things. You know who came? The nurses, the teachers, the doctors, the social workers. The clergy didn't come. And we asked them, we sent out a survey, why didn't you come? Because it had nothing to do with membership growth. The children, those homes, those are membership growth. And even so, it doesn't, the soul of the children, the soul of the families, we need to be involved in this. The children in our communities need you. Change will not happen, though, if you don't believe in it. If you do not believe in it, it will not happen. If we have no vision for our youth, for our families, it won't change it. We must have hope and love. In a hopeless world, we must provide hope. Our children need the church. I do not know of any ecology that is more powerful for what we're talking about than the church. Churches can provide the improved social environment if we didn't close our doors all week, right, and had an environment that was longer than a few hours on Sabbath. Our churches can often offer that raison d'être, the reason to be, of meaningfulness and spirituality, and healthy relationships. Dr. Hopkins is going to talk more about the different kinds of ways and things that this can be done, but this is what our churches need. I'm wondering how many elephants there are in your church. How many are we walking around? How many are we careful not to so we don't offend anyone? But we need to start saying there's an elephant in this room and let's work together on the issue so that we can open up the road and make that journey a positive trajectory, to open it up and allow the fresh air of truth to come in, to love them, to keep them safe, and to prepare them for a brighter future.